Hey guys, Nick here with another 5 minutes of couples therapy. This week I wanted to talk about disorganized attachment. So disorganized attachment is a combination of the fearful and the avoidant attachment styles we've already talked about in the previous videos that I've made in this series. So this develops when a child's caregiver is both the source of their security and getting their needs met, as well as a source of fear. So like I said, it's a combination of both the anxious and the avoidant attachment styles. And just to kind of recap those really quick, anxious attachment is when a child's caregivers are really unpredictable or maybe even neglectful, and it can make a child become overtly needy and clingy because they're always attempting to try to get their needs met. They can be overwhelmed with fear of abandonment and think really poorly of themselves in adulthood. Avoidant attachment is when a child's needs are not met at all, or they're even just rejected outright, and they sometimes are also ignored by their parents. So they stop expecting other people to be able to help them meet their needs. So these children tend to stop expressing their emotions altogether. They don't rely on other people. They learn to be really independent, and that's really how it shows up in adulthood. Adults with an avoidant attachment style have a lot of qualities that we kind of value. They look really independent, self-sufficient, things like that, but their relationships are very surface level, and they really try to avoid emotional intimacy at all costs. So people that are disorganized, they have kind of all of these traits, both the anxious and the avoidant traits. And this is also considered one of the most difficult attachment styles to treat. It's often the result of childhood trauma, significant fear in childhood. This can also lead to a lot of serious mental health problems, and it often co-occurs with personality disorders and other things. People with this attachment style seem really unpredictable. So like I said, disorganized attachment is typically developed as a result of childhood trauma or abuse. Their caregiver, who's their primary means of safety and security, is also a source of fear. This caregiver was probably highly unpredictable. They might be really loving at times and abusive at other times. And now a child doesn't really know what to expect in this situation, so early life can be really confusing and unpredictable. And even if a child wasn't the victim of abuse, even witnessing abusive behavior can cause this kind of attachment style to develop. So a child with an alcoholic parent, for example, when that child witnesses that parent being abusive towards their other parent or other people in some way, they could develop a disorganized attachment style just because of the fear that instills in the child. So that unpredictability of what their caregiver is going to be able to provide them, if they're going to be safe or not, that's really what causes this confusion around attachment bonds in adulthood. And so they might really want to be close at times, and they might want to be really distant and isolate at other times. So in adulthood, these people are very unpredictable in their adult relationships. They'll want to be loved and belong, and they might even be really anxious about their attachment bonds, and at the same time they're really afraid of those, and they might try to avoid them altogether just to avoid the anxiety that kind of a relationship produces. So they seem really familiar to the avoidant style, but the key difference here is that people with a disorganized attachment, they really, really desire having closeness and intimacy, whereas avoidants just want to avoid that altogether. So they aren't just afraid of being hurt also, okay? They expect to be hurt. Like, this is a foregone conclusion. So they have a really hard time believing that their partner is going to love them. They have really low self-esteem. They can even self-sabotage relationships as a way of protecting themselves from getting hurt. They often will even choose a partner that induces fear as some sort of a self-fulfilling prophecy about that belief that I'm going to get hurt. They have a really negative view of themselves and a negative view of others. So if you remember the anxious attachment style, they have a really negative view of themselves and a positive view of others. And then the avoidance, they have a positive view of themselves, negative view of others. People with a disorganized attachment just think that everybody sucks. So they have a negative view of themselves and a negative view of others. So these people have higher rates of substance use disorders, mood disorders, personality disorders. They might even be abusive towards their partners and even their children. So as far as treating this, it's most people with a disorganized attachment style usually just avoid being in intimate relationships altogether because that's the safest thing for them to do. And that works great, right? But it doesn't actually heal the trauma that's at the core of this disordered attachment style. And that can make life really difficult. So there's no easy fix to this. There's no pill that you can take. This takes long-term commitment and hard work to heal the trauma at the source of this disorganized attachment style. So I always am going to recommend working with a licensed psychotherapist. It can be super helpful. Here in Washington State, all therapists have master's degrees. We have thousands of hours of clinical experience. We're trained in this stuff. And I would highly recommend looking for a therapist that specializes in trauma work. So you can go, one of my favorite websites for finding a therapist is psychologytoday.com. You can go on there. I'm going to put it up on the screen right here. So let's see, I'm here on psychologytoday.com. I'm looking for a therapist here in my little town of Ferndale, Washington. So I'm going to type that in there. Then if I click on filters here, if you look right over here, I can select trauma and PTSD because that's what's at the center of my disorganized attachment style. And then I want to meet somebody in person, so I'm going to click on that. And then I click on view results. And look at that, I've got over 50 therapists right here in the little town of Ferndale, Washington, who can meet with me, who specialize in trauma. So definitely would recommend checking that out. Another great resource is the Disorganized Attachment Style workbook that you can get on attachmentproject.com. There's also an assessment and a quiz on there that you can use to kind of self-assess what your attachment style is. And then each attachment style has a workbook that goes along with it to kind of help you work through some of the stuff that you're dealing with. I always recommend daily meditation. Even just 5 minutes a day can help to reset your body's autonomic nervous system. And people with a disorganized attachment style are constantly being triggered by traumatic memories when they're in relationship with people. So, there's no way really that's really effective at getting out of being in relationships with people in our world. So this is something that's coming up regularly. So meditating, even just 5 minutes a day, can really help to kind of soothe that. There's lots of other mindfulness practices that you can do to help kind of reset that central nervous system, your body's trauma response when that gets triggered. So I recommend, if you go back to, looking for a therapist, finding somebody that specializes in mindfulness practices, dialectical behavioral therapy is very helpful as well. So those are, the resources I have available for you today to help with that. If you have any questions or you're looking for a therapist, feel free to reach out to me. I do have some limited availability. You guys are awesome. Thanks for tuning in for another week, and I'll see you all next week.